at the rodeo, but allergies and sinus problems stick around for longer than 8 seconds. With all the dirt, hay, and animal dander floating around the arena, it's hard to enjoy the scenery if you're constantly sneezing or rubbing your eyes. Here to help us deal with allergies and sinus problems for good, please welcome back Dr. Robert Palmer with American Sinus Institute. Good morning.
How you doing?
All right. I have a friend of mine who's down from Philadelphia, and she kept sneezing and kept sneezing. She goes, "It must be allergy season here." I'm like, allergy season in Houston's kind of like all year round.
Yeah, it is. I mean, we have problems with molds all year long, and in the spring we have a lot of allergens from the trees. We have grasses. So essentially, you're always having problems with allergies in Houston.
Yeah, pollen is very high, especially right now. You said, in fact, your plants are greeting you when you walk out the door.
Every morning they say hi. I mean, it's the post oaks and the live oaks are just full of that yellow stuff that really drives us crazy.
Yeah. Okay. Well, for some people, we have temporary allergy symptoms. You can take care of that with over-the-counter medications. But for many people, and at what point do we say, okay, we need to seek a more permanent solution here?
Well, I think most people have some form of allergy, and you know, if you can manage it and you get on your antihistamine over the counter and you do well, that's fine. You may do that 2 or 3 times a year. But once you get into recurring symptoms where you're having headaches and you're getting into infections, then it's time to see an allergist or an ear, nose, and throat doctor and get some benefit, maybe with not just over the counter, but for prescription drugs. They'll help. Topical steroids and topical antihistamines can help.
But a lot of times we have like multiple problems going on, especially with our sinuses. When they get blocked, then you cause all kinds of problems. You can get the infections, you can't breathe, you can't sleep, you're miserable, you have those headaches. And so there is a way to deal with that and kind of open it up.
Exactly. The whole ticket to sinus disease is ventilation, and we've known that for a long time, and we've done endoscopic sinus surgery. The problem with it, it's a pretty demanding operation. It's 2 hours. It's weeks of recovery, and it scares a lot of people. So they say, "No, I don't want to go through that. I'm going to go ahead and just take my allergy shots and so on." If those work, that's fine. But once you get into recurring headaches, post-nasal drip, and this continual problem of facial pain, and it's lasting more than 6 months out of the year, we came up with a technique, Dr. Rubio did, and he perfected the balloon plasty. And it takes 15 minutes to 30 minutes to do it. And it's absolutely amazing how well it works because it's all about ventilation. When you don't ventilate, you get into all these symptoms. And the reason you don't ventilate because allergies cause the nasal mucosa to swell and obstructs. And once you obstruct those little openings, that's where you get into all those symptoms.
In layman's terms, you have a plumbing problem.
You have a plumbing problem in the face.
Yeah.
And now we open it up without doing trauma.
Right.
We maintain the integrity of the sinus, so now it ventilates, and those symptoms are, they just improve dramatically.
And once you do this, is it done? Or do you need to go back in for the kind of...
No, it can be permanent. There may be a case where you may develop some symptoms again, but you can always go back and do it again.
Yeah. You know, we talked about taking medications, but for some people, taking those medications over and over again is not good for them. And, of course, when you have, like, things shut down, people will take the antibiotics over and over again, which is not good for you because they keep getting those infections. So if you're on kind of like that never-ending cycle, this is something that you should truly consider.
This is something you can do. And really, almost anybody can do it. You don't have to wait to have X-ray documentation to show blockage of the sinuses. It's more about the history. You came in and said, "I can't breathe, I have headaches, my ears hurt." You're a candidate. And I promise you, it works in 95% of patients.
Well, and you can tell right away. If you look at the patient, you can tell right away what's happening there.
And, you know, within 3 days, they're feeling a lot better. Their nose is not packed. No packing has to be removed. It's a remarkable operation.
Yeah. Downtime is about how long?
About 3 days, and that's when I say downtime, I mean you're up and moving, you're doing whatever you want. I just don't want you going out and jogging 10 miles.
Oh, there's no fear of that, trust me. Yeah, won't be doing that right there, but we can go shopping.
You can go shopping.
All right, all right, Dr. Palmer, thank you very much. For more information on American Sinus Institute, you can call 713-BALLOON, or log on to americansinus.com and get those sinus issues taken care of once and for all.